Good morning. Welcome to our Natural Health News live show, where I bring natural health news to you every day, virus updates, and tips and resources to keep you and your families healthy and safe during this crazy time. So I want to welcome each and every one of you joining us. Good morning. I hope you guys are up and enjoying the start to the weekend. I know right now it seems like every day is the same day, but I'm excited to share some really interesting news, particularly straight off the presses of the medical journals and research specific to the current viral state and potentially protocols that could help manage the treatment plan. And so this is really exciting news. And then we're going to go through 7 signs of a weaker immune system. So I want to highlight some things to look for in your bodies that might be indicative of the need to bolster your immune system. So we really have 2 parts to our show, just like all of the live shows here. And for all of you new and joining for the first time, welcome. I hope you will hit the subscribe or follow button. I have Instagram and YouTube both live this morning. And tomorrow, Facebook will join us. I have a whole new setup. So Facebook will be right behind you guys, and we'll be a trio of online shows. And so let me introduce myself. My name is Dr. Melissa Gallagher. I'm a naturopathic physician. My specialty is utilizing natural healing methodologies and natural medicine and incorporating functional medicine into the lives and welfare of my patient community. And that basically means as naturopaths and functional medicine providers, we look at the root cause of illness and disease and work to create balance and assist the body in leveling out some of the symptoms that are often diagnosed as disorders or diseases. So we go deeper than just one body organ or gland. We look at the whole body in a collective whole. So it's whole body medicine, and analyze how can we create a healthier environment where the body is most symbiotic and optimized. So if that sounds exciting, give me a thumbs up. I'm really excited to share with you. Today's video is actually sponsored by Call Me Go. I am really excited about this because I've been talking a lot this week about stress and stress management. And yesterday, if you tuned in live, I did a whole breathing a few weeks ago, I did a whole breathing exercise for the lungs, but I also do things to calm your lymphatic system down. Well, the breath is actually one of the most important things. And so Call Me Go, I'm going to share with you their box. This is what their box looks like when you get it. And this is the Call Me Go device. And Call Me Go is a drug-free, drugless calming device for your body. It has 3 core functions, and it actually provides immediate relief to stress, panic, anxiety. It relaxes the body, and it does it through 3 ways. So if you're used to breathing treatments, it's going to look a little bit like a breathing treatment. So this is the part that goes over your mouth, and you put it at a 45-degree angle. And the first thing, when you turn it on, it gives you these little lights, and sometimes it'll vibrate. And basically, you inhale with this machine, and it will regulate. You do this for a total of 3 minutes. It will regulate your breathing exercises. The second part is, I don't know if YouTube, you can see it right there. It has this component right here that, it smells fantastic. It's pure lavender oil. So it's a scented component, and it stimulates the senses, but also stimulates the physiological and psychological body to calm, because we know lavender it's been proven to be very calming on the body. And then this little part and this little switch on the side, this, when you activate it and you breathe in, it will turn on these little blue lights, and it helps regulate and adapts and reads to your breathing methodology. So it is not an e-vape or anything like that. It is simply a tool that you can use, and it comes in a cute little carrying case. So Calm Me Go, you can take this on the go. That's the whole point, calming on the go. But Calm Me Go is a great resource that you can, it's battery powered. And let me wipe off my lip balm. But this is the scented piece. So this is a little part that smells like lavender. You put it right on over here and click it in place. And it's battery powered. It comes with 2 batteries and a little, actually a really great tool that we'll be using a lot that unscrews it. So it has tiny little screws in the back. And this is so powerful. You can use this and pop it in your purse and off you go. And anytime you're feeling anxious, and I know a lot of you commented yesterday, you're at work, you're feeling anxiousness about the fact that you are in a work environment that's not social distancing, you can activate your calm anywhere with the Smart Calming Companion by Calm Me Go. So I want to really take some time to thank them for sponsoring our video, because a lot of us are dealing with anxiousness, stress, difficulty concentrating, and just need relief and difficulty sleeping. This is a really good thing to do in that incorporation of the nasal saline and doing the Himalayan salt like I recommend. And you could do this in conjunction with the REM sleep, which is the natural sleep supplement. So I love Calm Me Go. It's a really great tool. Drug-free, drugless is always my go-to. And because we are all having moments of stress, anxiety, and even panic, this tool, Calm Me Go, is very powerful. And I've got a link down below if you guys want to check them out. I hope you will. It's fantastic. So welcome, everybody. I see folks are tuning in from Texas. I've got some news about Texas, you all. Wow, lots of folks in Texas. I have a lot of followers that live in the Houston area too. Okay, so I am caffeining up. So I've got my caffeine and quarantine mug. And so we're going to talk about some news. Let's dive into it. Out of Texas, the University of Texas, Austin is challenging the IHME model that showcases that we are at our peak and that we should be able to open up around May 4th. So they actually are challenging the model and saying that that data is not completely 100%. And they are making projections that the 4 states that might be able to open up just based on their current state. And all of this is roaming data, right? So if we have a nursing home that all of a sudden becomes a hot spot in one of these areas, that changes everything. So everything is moving and mobile and changing. But essentially they said in May 4th, the 4 states that might be able to open up would be Hawaii, Montana, Vermont, and West Virginia. You know, those are communities, and we have Lois that often signs on, even though it's like 3 a.m. at her time. She'll sign on a lot of times, and she's not on yet, or at least I haven't seen her comment. But she is there, and, you know, they have had several cases. Some of the hospitals are overwhelmed, but it looks like from that model that might be the peak. But again, who knows in terms of what will happen? The key that this UT Austin report is challenging is that they're saying that we won't see some of these other states currently in the hotspot, like South Dakota. I reported earlier in the week, the pork plant, now they have over 800 cases in the plant, the Smithfield pork plant, which I think makes about 12 or 20% of the pork processing. So if you're a bacon pork chop person, you might start to see some food scarcity in that category. They're projecting that like Arkansas, Nebraska, South Dakota, Utah, and Oklahoma wouldn't be opening back up until maybe end of June, July. So that's just really something to be aware of. And then, there's more discussion and more assessment of looking at the nursing homes and analyzing the nursing home deaths, because we're starting to see those are the places that have the least amount of PPE. They're not equipped, it's not like a nursing home or long-term care facility has an ICU. They have a small quantity of capacity, if you will, in their morgues. And that's where we saw New Jersey. There was the case that I reported earlier in the week that they had 17 bodies. One of them they had tried to put in a shed and then moved. That tipped off the police. There's been more coming out about that. It was the largest nursing home care community. So it's a company that runs that. That particular facility, I guess, had a lot of citations from the state. So it's no surprise that, they just didn't know how to handle that. But it is very challenging. So if you have a loved one in a nursing home, long-term care facility, it definitely takes all of us, the community, contacting your local authorities, even your state representatives, to zero in and start calling and making sure those places are equipped. There's been more discussion of possibly looking at sending the military in, the medics, to be resourceful in that category. So I think that we're going to see more development, but the number of deaths just in nursing homes is almost 7,000 cases. That's a lot of people. And I want to share some news. So this came out of Nature Medicine. This is a particular type of study that looks at the viral shedding. When does the viral shedding of the virus begin? It's a pretty substantial document. And I'll pull this. I just grabbed this off my phone, so I didn't get a chance to link it up here. But what it analyzes is that they assess a total of 94 patients. 77 patients or what they have identified is that 2 to 3 days before they tested positive, they were already viral shedding. So there was already exposure and the virus had taken root and was starting to implant its DNA to make more of the viral cells. So what that says is that they were infectious at least 2 days before the onset of any symptoms or even testing positive. So they start to show the viral shed. Most of the time people would be isolating if they start to feel symptoms, but it's 2 days actually before that where they would need to isolate. So this new study just goes out a little bit further forward ahead of some of the testing and symptoms, and just showcases just how contagious this is. Now, this is hot off the presses, and we're going to see more and more. I heard a lot more yesterday about this, but I've highlighted one of my friends. Her husband's an ER doctor, and he has licensure in multiple states, and a lot of times he does relief work. And they spent Thursday night running through all this data, because a lot of the ER doctors are starting to converse about the fact that there are greater, I think it's between 60 and 80% of the deaths are deaths on ventilators. And what they're starting to analyze is this one doctor. His name is I think it's Giannoni. I don't speak Italian, but he is an Italian physician that is still in the midst of all of this virus in Italy. And because Italy was just so hit hard, they started kind of utilizing an alternative protocol. And so the idea here, and it's been hearkened by or highlighted by a physician that was in the ICU. Now he's transitioned to ER work in New York, where what they found is people actually went more downhill. A lot of cases, not everybody, but a lot of cases went further downhill. And, the cytokine storm I talked about, it ramped up even more when they put them on ventilation. And so he started to look at data, and there's not a lot of research. We are so in the infancy. But what was coming out of Italy is that, originally, this is, and I have to cover this up because YouTube's really weird about this, but the viral name, the question is pneumonia, ARDS, or not. And so ARDS is the acute respiratory distress syndrome. It's where we see pneumonia related hardening, a thickening of the lining of the lung wall, the lung tissue. And then also with this, they see kind of in different degrees, the upper, middle, and lower part of the lung. And when they're CT scanning, they're seeing pulmonary edema, so fluid retention. They're also seeing blood clots and some really bizarre, it's not current states, and these cases are not presenting like anything they've ever seen. So the protocols that they're throwing at it, what they're starting to identify, definitely here in New York, is not everything's working. And so what is now starting to kind of take note is that this, I think it's Gattinoni, this Italian doctor, started to assess that a lot of the symptoms, like what was the tip off, was that individuals could have really low oxygen levels, but be talking like they were still functional. They might not even known or felt like their O2 levels were too low. You have your pulse oximeter, the pulse ox machine that analyzes oxygen. So one of the things that he started to analyze it, because Italy had the Alps and a lot of potential cases that maybe he had worked on where they had altitude sickness. He started to analyze, this is very similar to somebody's at high altitude, extreme altitude, and like what happens with your lungs. Now, this resonates with me because I actually spent a full month hiking in the Himalayas and the Everest trek. So I've spent at least 7 days, full days, above extreme altitude. And that's like a whole other story. But in doing that, I had to research and we had to learn a lot. We had even met with doctors on the trek. And so this is really, it makes sense because I've even experienced my own body in the situation where you're not getting enough oxygen and you still are functional. So what they started to do is they started to analyze, okay, there's something called pulmonary compliance, like how well is the body articulating oxygen levels and the saturation of the oxygen. And they started to see that there were decreases in the compliance with some cases, and that they identified that some of that excluded edema and others included edema. And so they started to analyze, okay, what is going on? And when we intubate them, sometimes they crash. And so let me just sum it up. And this is a really good article. I have linked to this right now. This analyzes the CT scan and the lung tissue. And then they look at all of the kind of different protocols and what they're looking at. They look at the different volume. They look at the PEEP, shunt determination, prone position, NO, the nitric oxide, and then the different thrombosis levels. So they're analyzing a lot of things. And what he says is that, oops, sorry, I don't know why my phone's on. What they analyze is that there are many cases. It says it is certainly possible that lower compliance, i.e. lower gas volume and increased recruitability, is due to the natural evolution of the disease, but we cannot exclude the possibility that this severity of damage, including edema, results in part from partial respiratory management. So what they found is that the possibility of this situation where people are intubated and on ventilators actually makes it worse. Like the ventilator, some of their conclusions are that the ventilator causes severe hypoxemia or hypoxemia. And that's because the ventilation, the perforation is mismatched. Like they're getting too much oxygen and it actually damages the little sacs that need to be absorbing oxygen. So that's really interesting. Now, does that qualify for everybody? Probably not, but it definitely does potentially begin to shape some of the ways that we assess and treat these patients. Because right now, ARDS is the protocol, and ARDS is that acute respiratory distress syndrome. And what they're hypothesizing is that this is a whole new beast, and that it's not a thickening of the tissue, it's actually a thinning. And that because of the thinning and we greatly expand the lungs, they call it leaky lung syndrome. And then that puts strain on the heart and the kidneys. And if we go back, because, I've got my pile of paperwork over here. If we go back to where we're seeing ICU cases, the renal disease is the biggest and cardiovascular. So it could potentially exacerbate some of these underlying health conditions. Okay, so Kat Chevy, I heard this the other day, makes total sense. It really does. And it is interesting. So if you've ever been at high altitude for any period of time, it messes with you. Like I had really crazy dreams. Your body is trying to flush as much fluid, and you have to maintain an exorbitant amount of fluid because the body is trying to flush it out. It's very challenging, and you can trek, like you can hike and you can climb mountains and still be on a low level of oxygen. It is very interesting how the body adjusts, and there's an adaptation. And that's why a lot of these doctors are perplexed, because these people are showcasing values that in an ordinary circumstance, they should be knocked out, or they might already have been expired, but they're not. And so that's where they're drawing that it's presenting like an altitude sickness. So one of the things that is going to come from this, and I've read some additional materials, and the ER doctors are all conversing. So there's a lot of correspondence and communication about, in Florida, how do we deal with this? Just same way New York is. And so there's a lot of collaboration happening within that community. But if people present in this category, vents and intubation are not the way to go. It's push more oxygen. So deliver more oxygen, keep them over, it's not an over oxygenation, but if they're low, keep pushing them with oxygen. And so, that is the way that they're assessing and trying to treat them versus ventilation, which also changes the requirement of what these hospitals need. Now you can push oxygen in a rural community. You can push oxygen, and you don't necessarily need the ventilation, which becomes this whole other dynamic of, you need pulmonary, specialists and respiratory specialists and all these other people that come in with that therapy. You can have 12, 13 people catering to one individual, and then think about all the PPE. So that definitely does have a role of kind of assessing some of that. The other thing is, when we did our check-ins, there were two kind of levels that we did check-ins with the hospitals, or not hospitals. We had a doctor. I have doctor checkpoints up in Nepal, but like you check in and they measure, they analyze everything. And Diamox is a big one that people get. It's often associated with, the body's ability to absorb oxygen. So you metabolize oxygen better. So they're introducing that to some of these patients, and it's actually helping them. The other thing there is, let's see, what is it called? Dexamethasone. I feel like there's a different name for it, but I can't remember. But that is given for acute mountain sickness. And, for all of you new joining, I was highlighting the fact that I had before, after undergrad and before graduate doctorate work, I had one of these life crises at the age of 20 and 21. So I graduated school and undergrad and went and lived abroad. And then after a year of time in Japan, I hiked and went all around Southeastern Asia. And one of the experiences was hiking the Himalayas, like the Mount Everest trek. And there's really two routes that you can do. If you want to see Everest, you go a different route. If you want to scale and get to like base camp, you can go up the mountain. So we went an opposite way because I wanted to see it. And usually I have pictures of it in my office. I didn't pull it enough to show you. But we did that, and it was a full month-long process. Walking 10, 13 hours a day and staying in little tea houses. But there's a point where you get to altitude, and you're at altitude, and then you're at extreme altitude, and you're there for several days, and your body acclimatizes, which helps. And there's a lot of things people do. Like on the trek, you eat a lot of dal, you eat a lot of garlic. Garlic's big. You eat a lot of ginger, turmeric, a lot of the flavors and spices that is indigenous is very helpful. But it's very interesting because a lot of what I was reading is a lot of stuff that we had read and researched when we did that. But it's pretty spectacular. I would recommend it to anybody. If you are into walking and want to get into nature and see the biggest mountain on the planet and meet some of the most amazing people, breathe the cleanest air, it's pretty phenomenal. But it's not for everybody, and it was hard. So I always have used that, just a side note, I've always used that time as a time to know if I can do that, if I can walk every day for a period of time, I can do anything. Like this, it's like you just put one step in front of the other. And like, that's such a great lesson and such a great motto in life. Just one step in front of the other. You might be looking at like a peak that we're supposedly going to summit, today. don't think about the peak, just keep walking and you'll get there. And it's just little baby steps. And that's really what life is about. Okay, so I see some questions. Decor by Val. A New Hampshire doctor who went to New York City to help volunteers said one of the therapists they were doing in the hospital with patients, therapies, with patients is my neighbor turned them on their bellies with a CPAP machine and or a respirator. Yeah, so that's a prone. I talked about that about 2 weeks ago, the prone position. However, I actually have some commentary on that. So this article specifically highlights prone positioning. So this little statement, the prone positioning, they actually say in a traditional SARDS, that would be the way to do it. But the patients that present with this altitude kind of esque like sickness, they said prone positioning should be considered more of a rescue maneuver to facilitate the redistribution of pulmonary blood flow rather than opening collapsed areas. And they said long-term prone positioning or supine cycles is a very little benefit in patients with high lung compliance, and it leads to high levels of stress and fatigue in the personnel. So he highlights that because that was something that we did start to see. They were experimenting with prone. And I mean, it is hard. Prone is like belly down. And so you think like, how do you adjust somebody in a hospital bed? It's not like they have massage tables where your little head is cut out. So that's a really kind of unique way of figuring that out. But, you know, I think the other thing too is a lot of these physicians, particularly ER, they're trying everything. And I think this is a good step forward in terms of some possible treatment. Okay, so quick highlight. I want to highlight and mention Call Me Go. Again, this is our video sponsor, so I want to give them a little shout out. I don't know if you guys saw the beginning of this video, but Call Me Go is this amazing drug-free calming companion that comes in this cute little carry bag. And it looks like this. It's like a little kind of breathing machine, and that's what it is. It usually has a little cover like this. I've taken mine off, but it has a cover, and you can sanitize this very easily. And you turn it on, and there's a soothing aromatherapy component here. And you breathe in, and then you exhale through your nose. And you do this for 3 minutes, and it will regulate your breathing. The aromatherapy is lavender, so it's very calming, and it helps to adapt. They call that the scented element, the lavender up here. It helps to adapt and regulate your breathing. And so if you're feeling like, you know, physiologically, psychologically, you're dealing with a lot of stress, starting to feel like the heart racing, you can carry this in your bag. You can have this, you know, in a drawer and pull it out and just do your breathing. And nobody would know anything different than maybe you're doing a little inhaler. But this is very powerful. So Call Me Go is our sponsor of today's video. I want to thank them because this is all related to calming and de-stressing the body. And I think for me, I see this particular report and more of the talk about how are we treating this. You know, it's a paradigm shift. This virus is new. We have to have a new layer of treatment. And, you know, the other thing too is the way the American medical community and any of the medical communities goes. You know, paradigm shifts are really hard because they want clinical research, but we're researching on the fly and we're experimenting. And that is one of the challenges is you've got to have innovation within that. And there are providers that are innovating. They're analyzing what they're dealing with. Then they're throwing normal things that they know can work. And this might develop a whole new protocol, a new way of doing things. Okay, so let me share some good news, and then we'll go into the 7 kind of signs that your immune system is calling out for some help. Okay, number 1, did you guys see John Krasinski's Some Good News last night? He did a whole prom. It was a live show. It was awesome. So I'll link to that for sure. You want to watch that. Lots of laughter, lots of joy. I love him, and I love that he's continuing on with this series. Okay, so that's number 1. Number 2, Switzerland, they lit up the Matterhorn. You know, that is this beautiful mountain up there. Very picturesque. You guys would recognize it. They have the American flag flying on the Matterhorn. So it's being projected. I don't even know how they're doing it, but it's being projected on the Matterhorn. And it's a tribute to us, and they're behind us. And I think that is just such a telling sign that, you know, we have such international support from other individuals, and they're cheering all of us on to get through this and beyond this, because many of them are going through it just like us. So those are my little tidbits of good news. I will tell you, I got an email last week. I didn't read it fully until yesterday, but Amazon is really, really cutting back on, you guys know I always do my Amazon affiliate links. They are slashing their affiliate payouts by, in my case, 75%. So, just know I'm okay. That Amazon, it definitely does help, pay like Gabriel's school for us. But I'm okay. But I want you to know this, because I know you have other YouTubers that you love and support, and even, influencers on Instagram and other formats and outlets. Do expect some changes. I'll probably be kind of readjusting our model a little bit, nothing major, because Amazon is a great way for you to get access to a lot of things. But that is going to hit a lot of YouTubers in a really, really intense way. I know YouTubers generally don't make their money from ad money, but they do from, affiliate links and things like that. So what I want to kind of set the expectation, if there is the difference between it's on Amazon or it's in my clinic store, I'm going to be posting my clinic store. And that's Fullscript. They're actually an international company. The Canadian company bought the US version. And so we actually have 2 shipping locations, one up in the mid-Atlantic and then another one out in Arizona. And so we cater to all sides in the middle part of the US. And it only ships within the US. And our shipping process is just the same as Amazon. So just know that Amazon is not, they're cutting back, which is very frustrating. They're not paying their employees sick time. They've got folks infected in their warehouses, and now they are penalizing their sales force, folks like us that send you to Amazon to grab the things we recommend. So that's just very frustrating, but I have to put that out there. You guys might hear me highlight more to head towards my Fullscript store, which we do an automatic 10% off. And I'll link that specifically in the description box for you. But do consider shopping and supporting your YouTubers via, any of the links that could support them. So, okay. I love Octagon Biolab. Yay, Jenny, that's so good. Okay, so let's dig into 7 signs of a weak or weaker immune system. And these are signs, let me put this over here. These are signs, look at all this paperwork I have. I'm printing more stuff than I think I normally print. I'm going through sheets of paper. Okay, so 7 signs that your immune system is a little weaker and needs a little love. That's what I'm going to highlight today in this version of this video. Particularly, I think this will be helpful for any of you who are a little concerned and have a little stress, a little anxiety, and you need your Calm Me Go to calm you down. When it relates to, am I more susceptible, whether you have an underlying health condition or not, how can you support, bolster, modulate, and fortify your immune system? So that's what I'm going to empower you all today. I'm just going to run down the list. So number 1, an indicator that your immune system might be a little weaker is any type of mouth sore. This could range from canker sores to fever blisters. Both of those are going to be indicative of a weaker immune system. Canker sores often are indicative of vitamin deficiencies, vitamin C, vitamin D. So that's a good way to kind of highlight, maybe I need to be consuming a little bit more foods with vitamin C that are less acidic. So that canker sore can often be quite challenging when you're trying to consume your lemons or your citrus. There are a lot of other ways to get the vitamin C. Same with vitamin D. Vitamin D is very immune supportive, immune modulating, and I love that. The second sore that we have to be really cognizant of is the pox sore. So your herpes simplex, and you can have simplex 1 or 2. It's nondescript. Instagram, I have to plug you in. Hold on. Let me plug plug you guys in. Sorry, YouTube, I got to plug my Instagram community in. You guys are running low on the battery. So let's see here. I had this actually in my office upstairs. Okay, so let me just get you plugged back in. Hold on. Okay, I think you guys are good. Can you see me? You can hear me okay? Okay, so sores on the mouth, like a herpes sore. Herpes 1 or 2, you can have one or both. And those can be very problematic. They can be, in the corner. They could be right on the top, bottom. They can even be on the inner part of the lip. And a lot of times people think they have a canker sore, and it really is a herpes sore. The difference here is a lot of times you'll feel the nervy pain. It's like lightning strike, kind of intensity. Even lymph nodes will get swollen. It'll feel like you're getting sick, but you just get a sore. A lot of times people will get a situation where they even run a fever, or stress will induce that. So that is definitely something where you want to make sure you're supporting your immune system. But that's an indicator. Immune system is a little bit on the lower end if you're starting to see those sores pop up. And they can pop up anywhere in the body, particularly in the mouth, but also herpes sores can pop up, the genitalia, but also shingles is a pox virus. And shingles, I have a lot of people outbreaking with shingles right now. So I love to use apple cider vinegar at the onset, like as soon as you start to feel it, especially if folks are familiar with it, it's coming on. The best thing is to grab a cotton ball, and wherever that sore is, soak it on there. And the apple cider vinegar has this potency of being able to change and alter the pH, but also it speeds up that whole process. So a lot of times it won't puff up. Sometimes we can get it even to crust up really fast and go away before it becomes this like full-blown week or two long yuckiness that happens. And especially on the oral, the mucosal lining, it's harder to heal because we're talking and like moving around, and it gets wet, and then we're looking at it or picking at it and not realizing. So mouth sores, that's number one. Number two, an inability to sleep well. So this is a big component where I've heard a lot of people complain, I'm not sleeping well. And I've done probably 4 videos, I think, on that thus far in our live show, where I talk about how to get better sleep and how to really enhance that rest-filled, stress-reducing, adrenal balancing sleep. So my recommendation is always the REM sleep product. I think you guys are familiar with my recommendations there, and I'll show you. This is my go-to. This is my natural kind of sleep aid that I just adore and find that it's very helpful at achieving the right type of sleep a lot of you need. The other thing that I find that this does is it keeps you sleeping. It lowers your stress levels. It reduces cortisol. It balances blood sugar. It minimizes the hot flashes, night sweats, and things like that. And the other thing that this does too is it helps balance the neurotransmitters. So it has 5-HTP, which is very powerful at minimizing the kind of depressive state. And that is really, really key. And Decor by Val 1 magnesium, this actually has magnesium in it. So, and it's got the right bioavailable version of magnesium. So I love to recommend that. But that is definitely like, if you are restless, you're waking up between 1 and 3 a.m., or you can't get to sleep because your brain is going and it's just, you're just thinking about all the things in the day, and then you're just really kind of getting intensity. Again, harkening back or going back to our Call Me Go. So this is our video sponsor today. This little unit, let me pop it off here. This little unit would be great to have right by your bedside. And you could take your gel and then breathe this in, do a 3 to 5 minute breathing treatment. And it has potency in terms of being able to balance your body out, balance and lower the kind of brain thought. The other thing too that I love about this type of product is that when we focus on breathing, we don't, it's just this, we can't focus on, the thought that's causing us the stressor. So when we're focused in on breathing in and breathing out, breathing in this case, you breathe in through the mouth, you breathe out through the nose, and you're breathing in also the good aromatherapy from this little insert. You actually recalibrate the brain. So that's very, very powerful. And REM sleep, so I saw something, how long can you take REM sleep? There's no sort of, no sort of recommendation like take for 6 days and off for 3. I recommend it, especially if people have really intense sleep imbalances, at minimum to take it for 3 to 4 months. This is really good. They've got 10, this is a 10-day box. So it just comes with the little packets inside. And then they also have a 30-day. So you can kind of use it. In the beginning, I recommend taking it every day just to balance out. And then as you kind of start to see, you use it as needed in some of those cases. But there's nothing wrong with taking it every day. It's just that potent. So sleep, if you're having a hard time getting to sleep, staying asleep, waking up really early, those are all indicators. Cortisol is at play. There's hormonal imbalances, maybe some temperature imbalances. But that lack of sleep leads to the third one. If you're feeling fatigued all the time. So part of it is lack of sleep. Your adrenals are getting rejuvenated. And yesterday we highlighted a reflexology point. And did you guys love that? For all of you who joined on the live, you can watch that. Yesterday's replay, Instagram, it's over. A lot of times we only have this, it's 24 hours, but it's over on YouTube. And I highlight an exercise that you can do. And I'm going to try and kind of break out some of the valuable content in each of these videos as individual videos too. But, that's very powerful. Your adrenal glands are a lot of times the reason we're fatigued. And then also fatigue can be indication that your body is run down. And also the cytokines, we talked a little bit about that. Sometimes the cytokines could be exacerbated and causing you additional fatigue, inflammation, inflammatory states. So, and that, plays into also when we have any type of weakened immune system, we'll often see some sort of rash or skin involvement. And this is where sometimes hives, but mostly like rashes, like redness, bumps. That's a digestive aspect. So the skin is what we call a secondary elimination point. And then we look at the primary elimination point, which would be the digestive process. Liver cleansing, liver detoxing, dandelion tea once or twice a day is not a bad idea to kind of keep the liver flowing and getting a lot of the junk out. And I really feel like that also plays into both the inflammatory state of your body, especially if it's red and inflamed. And this also plays into cystic acne. I've had a lot of people comment. Some of my healthcare providers are getting more of the acne because of the wear of the masks. And that, if you guys want a specific video, I was thinking about how do we kind of take care of our skin so that we don't get those rashes, or not rashes, but acne, it's oil and buildup. But the other thing that is at play is cystic acne. It gets inflamed and red. So that is also an indicator of the digestive imbalance. And depending on your body type, and sometimes the glandular organ weaknesses, some people, it tends to be their digestive process that, when they have worry, they have diarrhea. If they are angry or whatnot, they have constipation, or they've got IBS, and it's a combination of both. That will manifest in the skin. And that's indicative of a weaker immune system. Now, the fifth one is kind of twofold. It's frequency of getting sick, where you're kind of chronically ill, or just have a lot of allergies, food allergies, allergies to outside, allergies to pets, and, everyday things. We see this a lot with a lot of younger kids. And some of that is indicative of just the nature of their environment. Sometimes they don't have enough digestive bacteria. And that is something that we have to address when we're looking at the immune system, because when there is a frequency of illness or, chronically sick or cold or whatnot, here comes Daisy. You want to say hi to everybody? Come here. Oh, Daisy wants to say hi. Say hi, everybody. We got a little Daisy action here. Say hi, everybody. That's a good Daisy. Hi, puppy. I know, it's a good girl. You want to? Oh, you know what? Daisy can smile. Smile, Daisy. Oh, show them their smile. Smile. She has a really ugly smile. Smile. Can you see it? Smile, pup. All right. Oh, you're dirty. Oh, yeah, you're dirty. Okay. Oh, yeah. Oh, he didn't wipe you up. It rained last night. And she's really dirty. I'm going to have to, I'm going to have to change. Okay, so that's Daisy. She's so cute. Her smile, it's really, poor pup. She's a cutie. Okay, so, frequently if you're sick or have illness or kind of notice that you get sick a lot, that is definitely an indicator that the immune system is just not leveled. And so that can also be brought on if you have autoimmunity. So autoimmunity will be a factor where the immune system is just not modulated. And I've talked a lot, I've done some videos here, so you can go back to those. I've talked about immune modulating herbals and other supplements that you can add into your regimen. But that would be something that would not be a bad idea to think about adding in to your regimen if you do experience a lot of allergies. And then also if you're getting sick, but that's just your body talking. And so as a naturopath, we kind of look at, here she comes again. We look at functional medicine from a perspective of how do we resolve and address the language of the body, the language that your body's telling you when you have you have frequent allergies or you're getting sick a lot. It needs support, and the immune system is not optimized. And so we need to optimize the immune system in a way that we can really bolster your natural immune response. And sometimes that is just some biochemical imbalances. And then sometimes even deeper with the autoimmunity, there's a whole lot more to it. Okay, so let me see. I just want to add something on here. I forgot to add in a probiotic. So I saw somebody ask about, I don't remember who it was. Somebody asked about thrush. So I'm going to talk about that. Thrush is candida. So this is the sixth kind of indicator that you have a weakened immune system. And you guys may or may not be aware of what thrush is, but essentially candida, we have localized yeast imbalances. So candida is a type of yeast. It's in the bad yeast category, bad bacteria. We need it, but we don't need it in an exorbitant amount. So when the numbers get great, that's where we start to see these imbalances. So for instance, candida can be everywhere. It can be in the mouth, the oral cavity. It can be in the sinus cavity. This one and up here. You can culture and people can find they've got candida. You can have it in your eye, you can have it in your throat, in your stomach. All of the mucosal membranes in your body can be plagued. Then you can even take it deeper and you can assess your blood. We can have systemic, whole system, whole body yeast. We can analyze yeast, fungus, floating in your blood. So how we do that, a lot of people can do live blood cell analysis. So you do like a little pinprick, you get 2 glass slides, and then that goes under a microscope, a microscope. And a lot of times providers will have like a big screen and you can look and see your live blood. You can see white blood cell, red blood cells. You can see if they're jagged edges, are they sticking together? We can see pathogens sometimes like Lyme disease. You can see the spirochete in the red blood cell. That's freaky. It's a parasite inside your red blood cell. And you're like, oh my God, they're everywhere. Or you can see this kind of floating cloud. Well, that's yeast. And so that also is an indicator. You want to say hi again? That's an indicator that the yeast, it derives often from an imbalance in the digestive process. And the best way to deal with that is to increase your probiotic use. Now, candida, or a lot of times people might call it thrush, but candida in the mouth, like if you stick your tongue out and your tongue is not pink, so mine's pink. If your tongue is sticking out and it's white or filmy yellow, Or your lips sometimes get a little white. That's candida. And so you can start to see your tongue. That's why a lot of Chinese medicine doctors, they will analyze they have a kind of a protocol when they analyze your body. And a big thing is they say, stick out your tongue. And so you stick it out and they kind of see, the heat and or dryness. They see, the dampness or whatnot. So the yeast, a yellow kind of cloudy, filmy coating on the tongue, that's yeast, candida. And the best way to address that is to add in probiotics. So I have one of my favorite probiotics linked down below for all of you, so you can grab that. But that's a really good way to support and fortify the body in a way that that would be balancing. I mean, there's a lot more to this than just taking a probiotic, but it's a beginning of balancing some of the yeast. Thanks to Core by Val. I work really hard on it. So yeah, and what I've added for you is the link down below is a 12 strain probiotic, and so it is focused on kind of addressing and fortifying both the immune system, the digestive process, and will address a lot of the kind of bacteria that gets in the mouth. Now, the other thing is tartar and not gingivitis so much. Gingivitis is triggered, but tartar plaque buildup, that's mostly caused by candida. So, but definitely, adding in really strong probiotics would be powerful. And it's a combination of a strong quantity of them, but mostly it's the powerful multi-strains. And, probiotics are very, very helpful. Kim Montgomery Kids probiotic suggestion. There are several. So with probiotics, every month I alternate. And I want to bring up one. Let's see, kids probiotics, the one that I recommend a lot. Let's see if I can grab that link for you. I might have to DM you. Let me write that down. I'll DM you, Kim. Okay. So, but yes, kids, definitely, children, infants. So we have infant drops, just like D, for babies, straight out the gate. Vitamin D drops. I love vitamin K. And then also probiotic drops for infants. Really, really healthy and very powerful at minimizing any kind of constipative states. And that often, especially if babies aren't being breastfed or they were not vaginally birthed, and that is a factor as an adult. A lot of times, when I ask my patients, like, tell me about your birthing process, like how, were you a C-section baby? We see this more so in the younger, 35 and younger. But there are a lot of adults that are walking around that never just had the good basic probiotic balance, the healthy bacteria balance, because as babies, we exit through the vaginal canal, we actually absorb healthy bacteria. That coating on the skin is very healthy. And so when nurses try and wipe that off, that's not good for their digestive system. Okay, so if you like this, if this is resonating, please give me a thumbs up. Very, very, very powerful. Candida, that's a class that I could do for hours. But I work with a lot of folks that there is some degree of yeast imbalance. If you've ever had any type of antibiotic, and there are different types of antibiotics, different powers, then IV antibiotics are like a whole nother class of destruction to the digestive, flora, the bacteria flora. And then, we see a lot of women have interstitial cystitis. There's bacteria that can get into the bladder canal or, the bladder itself. Same with men. In the prostate, there's yeast and pathogenic activity within the prostate gland. And so it plagues us in ways that we don't really realize. Okay, so my last and final, number 7, is slow wound healing. And this is really one of those things that a lot of times we don't always pay attention to. Like, for instance, we're doing a lot of gardening. I've gotten scraped up, and the normal reaction of the immune system is get a little pink, you have a little scab, and most of the time it won't turn into an infection. And for the most part, it should be healing in 3 or 4 days. Well, a lot of people are slower on the wound healing. Sometimes that can be because of an underlying health condition like diabetes, circulation challenges, immunity. A weakened immunity can be an indicator we don't have enough, of the right white blood cell or red blood cell counts, delivering core nutrients to process and promote the healing. That is another big factor too, is anytime women and men come to me post-surgically and they're really slow to heal, there are a lot of layers. There's definitely nutrient deficiencies. There's collagen deficiency. So collagen is a huge part, bone brothing and all of the kind of collagen supportive that I talk a lot about. But also too, stress is a big factor. Cortisol will slow the wound healing process, and cortisol stress will weaken the immune system. And, just going back to like number 2, lack of sleep, you don't sleep well, you are not going to heal fast. And so that's why REM sleep is a really big factor in terms of getting you sleeping better, calming your body with the Calming Go, our VO sponsor. This smart calming companion is fantastic. It's drugless, drug-free. 3 minutes is all you need. And you're, inhaling in and then breathing out, and it modulates your breath and calms the anxiety, the sleeplessness. Very powerful. So there's a link down to them. If you want to check out their website, it's www.calmi, CALMIGO, so calmigo.com. And so great. And the booklet, I have to say, I get a lot of products sent to us. These guys, so they have 2 of these, the little scent, the breathing scent strips, the kind of scented apparatus, the Element. They have a little important strips. They have a video tutorial, so you can watch a video. They kind of give you a rundown, very detailed. You get a quick start guide. There's a user guide, and then it has a year warranty. So how awesome is that? Because I know I'm going to be using mine a lot. It has a little warranty in here. So it's a really, really great quality product, great company. And it's literally small enough you can put in your purse. I have a lot of cute little like smaller purses. It fits, I've checked already. It fits in there. It's smaller than my phone. And it's just a great way to get some personalized and, technology that can personalize itself to your breathing and calm you down. So love that. Very, very powerful. So I see Decor by Val, vitamin E for wounds. I actually prefer, instead of vitamin E, zinc. So I don't know how much you guys all know about my background, but I do a lot of post-surgical work. So I have plastic surgeons and surgeons of all categories, cancer doctors, true plastic surgeons, elective surgeries and non-elective, from hips and knee replacement surgeries. They refer to my practice because I do the post-surgical healing. I do a lot of lymphatic promotive work, which is a big part of reducing the fluid and inflammation to promote healing. But zinc, so I use this high-grade zinc and send people home with the zinc product that it is phenomenal. And I mean, I've seen folks that, they've had hematomas explode. It sounds horrible. I don't want to say that. And like, you can have a hematoma, and if it doesn't get eradicated, it will find its way out, and it can be quite traumatizing for patients. But I tend to catch it early. I work with the physicians, and we have a whole protocol for that. But even after that, if that happens, I can use zinc for even like my melanoma cases where they're packing with, we're talking like sometimes there'll be a wound that is open and it's that deep, like several centimeters deep. I will use zinc and boom, like we're healing it up, and way faster than anything. A lot of times that's how I get these referrals, because they see how fast the work is, what I'm doing is actually working. So not to toot my horn, but that is one of the big things that I do. And healing is a huge part of getting better, getting back to normal life for a lot of folks, especially my cancer patients that already feel something else has taken over their life. the one thing we can control is that whole healing process. So what does bloody looking bruising mean? Vitamin K deficiency. So if you bruise easily, that's a vitamin K. Look at adding K2 and MK7. I would totally promote that. Okay, so Instagram, you've got 18 seconds. Yeah, it's probably going to cut off now. We will follow up on the back end. Yeah, I don't know why it does that. It just shuts off for some reason. Okay, so I just saved that. Let's see. I'll cue them up again. Ace Cats, I need to order the Smart Calmer. Is the link listed? Yes, the link is down below. www.callmego.com. I don't know, my lighting's, let me see if I can fix that. Yeah, that's better. My lighting was a little too intense though. Okay, so let me share the story on Instagram. I'm coming back up. Green Taylor, I've been in and out of the hospital rehab since October 16th. I've had massive doses of IV antibiotics and oral antibiotics, and I'm currently trying to figure out. Just start with a really heavy strain. I would pick up the one that I linked down below. And then after that, there's a real, see how you do with that. Because a lot of times those really intense antibiotics, you'd want to kind of slowly introduce your probiotics. When you want the base level, that's a good grounding probiotic. And then what I would do is I would look at, there's a red powder. It's a 34 strain, high intensity probiotic out of, I think it's Garden of Life. And it's a red powder. It's usually in the refrigerated section. You might be able to get it shipped to you, but they'd probably have to cold pack it. Then I would do that. And I would do that for like weeks. Okay, I'm bringing back Instagram. Hey, Instagram, we're back for part 2 of our morning natural health news show. Welcome back, everybody. We are just kind of wrapping up our show. Talked about the 7 signs that your immune system needs some support because it's showcasing a little bit of weakness. So for everybody, I'll just recap. We'll go down the list really quickly. Number 1, mouth sores like canker sores or pox viral sores like herpes 1, herpes 2. Number 2, a lack of sleep or an inability to sleep well. You're not getting to sleep. You're waking up, just not feeling rested. 3rd, that ends up leading to fatigue, just feeling run down and tired all the time. 4, skin rashes are a really big component and indicators of a weakened immune system. 5 is going to be where you're frequently sick or experiencing a lot of allergies or have allergic reactions to food and things like that. 6 is candida, where you have a white tongue. So when you stick your tongue out or around your lip, like right here, if you notice you get a little white coat or white tongue, that is a candida, an overgrowth of bacteria that we need to balance with good probiotics. So you guys want a probiotic, DM me and I'll send you a good link for the one. And then the last is slow wound healing. And before it cut off, we were talking a little bit about zinc. Somebody had asked the quantity of zinc. So I actually like to, get my zinc in a lot of different ways. We eat a lot of seeds and nuts in our lives. So seeds and nuts, root, those are really good. Root vegetables. Then also I use a liquid ionic trace minerals that is zinc forward. And then the other thing that you could look at would be zinc capsules. But the thing is that not all zinc is created equally. And I like the liquid. I like food first, then a liquid. But then a lot of times people have issues with zinc. Like you can't take zinc on an empty stomach because sometimes it'll make you nauseous. And even my liquid trace ionic minerals, that will cause me, if I don't eat a substantial breakfast, I can't take it first thing in the morning. I always have to take it like after lunch. Very, very helpful. So yeah, let me see if I'll pull that up for you guys on YouTube. My zinc. I think that's it. Let me check it. Let me check the link really fast. But yeah, zinc is huge. Let's see. And zinc is definitely one of those things. That mineral is a kind of frontliner for helping balance the immune system, helping the immune system adapt. Why it's not doing that? Adapt to any imbalances within the immune. So it'll regulate the immune system. And then it also has an amazing ability. Yeah, this is it. This is trace ionic. Let's see, trace ionic. right, so there's a link down below for YouTube, you guys. So very potent in terms of just supporting, but on the front end. So like if you start to feel like that frequency of a cold coming on, you want to start it at the beginning. If you take it midway, it doesn't have the same effect as like being a kind of a wall to the immune response. Okay, so I want to answer lots of questions because I feel like a lot of times I've just been kind of blown through. And because Pat, by the way, thank you, Pat, for being our moderator. She lets me just kind of talk to you all. And so I often am missing a lot of questions. So I want to answer questions. And again, these questions are specific to this content topic. 7 signs of the weakened immune system or related to the viral, the data, the research that I was highlighting today about, whether it's pneumonia or SARS or something else that we're dealing with. And then also the kind of 2 days, the infectiousness, or transmissibility before even folks are testing positive. Okay, so only see 2 blue thumbs up. I don't know what's going on, but yeah, please give me a thumbs up. If you guys like this content, give me a thumbs up. Tomorrow, I want to announce we're going to bring up Facebook. So I have a whole new contraption. I've had to rework my desk. I have a light over here, and I've got my little camera there, and I have my phone, and I'm going to have the mini iPad. It'll be Saturdays and Sundays now, but I just couldn't get it all together. It's this huge thing that's basically going to hold. It's going to sit. I can adjust it so it can sit right kind of at the level. So when I'm talking to all of you, I can also talk to Facebook. But we'll have my Facebook group on live. So if you guys do Facebook, I have a group. Facebook is a little different because somebody also already had my handle. So if you want to find me on Facebook, it's Your Natural Health Resources. And the group, the private group, is Your Natural Health Resources Community. So I actually have questions that we ask people who join the private group. And it helps me target the content just on Facebook and then also in YouTube. So I like to know who you all are, what all you're dealing with health-wise, so that I can address that more in content that I put out. Kathytopia. I'm going to make some homemade sauerkraut. Ooh, that sounds great. I tell you what, the smell of sauerkraut makes me totally nauseous. I know that stuff is so good. It reminds me of my grandma. She used to make sauerkraut. Oh, she was German, and man, but she would make it with this great pot roast that had all these vegetables. And I love the pot roast and vegetables, but she just put the sauerkraut right on top of everything. But I tell you what, she lived to 98, and she had a really strong, healthy digestive process, even to the end. So there's something to be said about fermented foods are fantastic. Very good for the digestive process. Okay, let's see here. Ace, appreciate your elderberry recommendation. Yay. Let's see. Basketball fan. I'm Irish. Okay, so reflexology point for bloating. I could definitely do some digestive step. And actually that is something, if you guys want a digestive focused video, comment down below, let me know if you want me to do anything really specific. Sandy Beach 08, been hard to boost my immune system because I have interstitial cystitis and citrus hurts. Okay, so the good news is citrus is not the only exclusive immune balancer. So I actually don't consume any citrus other than like lemon and lime in my tea. I just can't. I can't stomach it. Never have been able to. The only citrus I do and I'm good with is pink grapefruit. I love that stuff. I can handle that. So, dark green leafy veggies, you can get immune boosting vitamins outside of citrus. So, get your minerals in nuts and seeds, pumpkin seeds, sesame seeds, Brazil nuts, really great for that. Somebody added celery juice. Not everybody can handle it. But for sure, green juicing is key. Steamed kale, steamed broccoli, steamed spinach is very powerful. Very good stuff. But, definitely, berries are really potent. Just think about eating rainbow. I love the rainbow color style eating versus getting really specific into one style of diet. I'm not big on diets. I don't like that word. we are living healthy lifestyles and we have to make choices, but also we need variety. So always kind of switch things up, and that's actually what I'm loving with our veggie delivery box is it changes. Like I have 5 or 6 sweet potatoes left and an onion to deal with. And ordinarily I might not have those just kind of sitting aside. So, that's helpful. Yes, use seed cycle. Love seed cycling. So great for that. Okay. I see 2009 BA, can't sleep, don't get enough sleep, though don't have any issues, but my stomach is big. That's cortisol for sure. Cortisol and, a lot of times women hold our stress in the lower tummy. And that can be over time. We just store excess calories. We store excess insulin to protect our core organs. And a lot of times that just happens to be right over the lower tummy area. It's pretty darn annoying, isn't it, ladies? All right. So let's see. I'm going up on my questions. Oh, we love the adrenal points. Oh, that's great. Okay, let's see here. I'm going down. Candida. Let's see. Where was that? Okay, so yes, digestive video, bloating. I don't think I've ever, that's a good note. I don't think I've ever done a bloating video. There are a lot of videos, content. I have all these you can't see, but I have like all of these sticky notes, and then I have notebooks of ideas. There's not enough time in my day to get all this stuff out. I heard that lipomas can even grow in the lymph nodes. Is that true? They don't grow in them, but they can grow around them. Lipomas are these kind of fatty tissues. They can grow in and around. They can often feel like a lymph node. And there are some disorders that those are more prominent. And they actually kind of have like a little tail. Durkheim's, check out Durkheim's if that's something that there's a definite lymph connection to. Okay, let's see. Is coconut cream healthy? Been using it. Yeah, I actually like coconut cream. Depends on, as long as there's no carrageenan. So I don't know if you guys have watched my video. This is probably 2 years ago I posted it. An ingredient I absolutely detest that is cancerous, that we know for sure causes cancer, is carrageenan. Carrageenan used to be in a lot of the like So Delicious, like dairy alternatives. They've since gotten rid of it. I still don't buy their product. I still am like, eh. But carrageenan is a congealing kind of agent. It kind of keeps things together because a lot of times coconut like cream wouldn't stay together ordinarily. So they have to put something else in it. So yes, I am planning the webinar, the hormone webinar. I actually was working on that yesterday. There's a lot of back-end processing for me to even get you to get in. So I have to build a landing page. I have the content, but I have to write that out. I usually have slides with giveaway, like downloads, and it is not a quick and easy like YouTube turn on the camera. So there's a lot of back-end work for me to do that, which is why I'm going to be charging for it this time, especially now with darn Amazon. So rainbow eating, yay. Jenny Field makes a smoothie with tons of veggies. Takes me about an hour. Yeah, I totally get it. No, it's so worth it. That hour of time, you are worth every bit of that hour, and your health will greatly benefit from it. All family and friends should know about Dr. Melissa. Thanks, Big Dog. Can I link? I actually have the link. The probiotic should be in the description box. Let me just save that. So it'll be below REM sleep. You'll see probiotic and then the trace ionic zinc. Let's see. Do you have videos on Candida and how to treat it? I actually do. I have probably 4 or 5 videos on Candida and digestive related imbalances. I hear a little man. Come here, bug. Let's see. Do you guys want to see Gabriel's new jammies? I had to buy him new jammies because the kid's growing really fast. Hey, Brian, can you bring him in here, please? Okay. So Gabriel loves doggies. Oh, you changed. Oh, come here, honey. You changed. Sorry. Come here. Here, you have to show them your doggy shirt. No. They love Daisy. Do you want to say hi to everybody? No. Come here, please. Come here. Does not like you. She doesn't like me? Well, she smiled for me. Well, there you have it. So he said no. Sorry, friends. He might come back tomorrow. All right. So let's see. Diverticulitis. Yeah, that's, diverticulitis is essentially, if you think about it, it's like a blackhead inside the digestive process. And there are these little pockets, and it sounds gross, but they fill with your fecal matter, and they become infected, pussy. I love psyllium. So the previous video sponsor, Bellway, that would be a really good psyllium. Actually, like pulls that stuff out. You won't ever heal those up fully, but fiber and that kind of insoluble fiber is very, very powerful. So I love that. Okay, so yes, thanks. Give me a thumbs up for all of you joining. Gabriel, he had a day yesterday. Yesterday was really hard. It's really hard for the littles. If you guys have kids, it's really hard. The social distancing and the lack of connection to their friends is really, really hard. And so I've noticed a few little areas where he's starting to regress a little. I think that's totally normal. We're not freaking out, but holy cow. So we as parents have to step in more and just keep him as socially connected as we can with his friends and family. And school is really, online school for a 4-year-old is really hard. So anyway, wish us luck. But we're plugging through it, as most parents are, juggling everything. And yeah, it's crazy. Okay, so I cannot get my upper respiratory allergies to settle down. What can I do? I would check out yesterday's video, Carrie. If you didn't watch it, I go through kind of a sequence, like nasal spray. I don't have everything here. Nasal spray, the aromatherapy, the saline, and then lymph drainage. I promise it works every time. Do that several times a day. John says, I love children and I don't call them kids, but rather lambs. Well, that's cute. Yeah, he's a cutie pie. So let's see here. T fatty lymph nodes, inguinal. Yeah, so Jeannie Field. Yeah, I check out Durkheim's. Okay. All right, friends. So school is tough. Yeah, Zoom classroom meeting helped my 4th grader and kinder C teacher. Yeah, so they actually do. I have to say, Gabriel goes to a private school, and it's a smaller school. They pivoted really fast. Like the week that we had the case here in Atlanta, there was a teacher in the public schools who went between multiple schools. So they shut down all the schools. We were in spring break mode. That was the week before the wedding. Chaos. So it was 2 weeks before the wedding that he was off school. And then it was the week before that we were doing planning. We were doing planning and everything. So he was out of school. They closed the school after spring break. So he had been out an extra week. They anticipated that we might not be coming back, and they sent sheets of stuff home, packets. He had like crayons and markers and a whole bunch of stuff. And then they pivoted. So every morning, why we love this school, it's non-denominational, but they gather the whole entire school. So like they have infants all the way to 8th grade. They all gather together, and every morning in the school, they have this auditorium. And the main principal gets up, the head of school, and she gives some inspiring message. And then usually one child goes up there and reads a prayer. And then they have another student, and sometimes 2, depending on the size of the kids, but they will say the pledge. Well, they've continued that tradition. So at 8:30 every morning, he logs in, and it's Mrs. Dishman is the name of the principal. And she has her daily show. They post it on Vimeo, and it's called The Daily Dish. So she gets on. It's really cute because she has a little dog. And so she'll bring her little dog Cupcake on, and Cupcake has outfits. And I mean, Gabriel loves Cupcake. He gets more excited about seeing the dog in her show. But it's really great because they've done that. And then Tuesday and Thursday, he has 2 teachers. One will video conference him Tuesday, and the other will conference on Thursday. And then they do a circle time conference, which is just insane. Like some parents aren't muting, and the Zoom, it's all over the road, but they've been slowly figuring it out. But we have exercises, activities. He has science and Spanish, and the PE teacher posts videos. But I tell you, it has been challenging because there's a lot to do. And then he has ABC Mouse activities. And, at 4, he hasn't figured it out. And my mini iPad, he's figured it out, but he still needs guidance. So he calls my friends, he'll video chat with my friends. So I'll get calls like, I missed your video chat. I'm like, what are you talking about? So if he ever goes live and you just see a face, it's Gabriel. He'll have at some point figured out how to work YouTube. Dishman. Yeah. So Mrs. Dishman, we love her. But yeah, so that's kind of the scoop on the homeschool front. I've got a homeschool parenting shirt coming that I'm going to rock out on our show. And again, all the Etsy vendors, I have them, I think almost all of them linked down below. This you can get from Etsy. This is my cute little, it's a little glitzy. So it's a little, what is it called? Rose gold. This is my favorite. I love rose gold. So, yeah, tons of fun. Let's see. I'm college student who's on ADHD meds. Can you make a video on how to get off? Yeah, so that's really hard. Destiny, I totally feel you. And it's really hard legally for me to kind of implement a video of getting off of medication. So I'm bound legally to work individually with folks. So I can't make a specific video of how to get off of medications, but I can offer alternatives. And so neurotransmitter testing would be the first thing I would do, because a lot of neurotransmitters are going to be imbalanced. And then you can target those with enzyme therapies and neurotransmitter therapies. Keep it simple. I'll share my preschool curriculum with my daycare kids virtually too. Yeah, it's huge. And I actually queue up YouTube. So my whole thing is not to treat him as he's 4. So even the books we read are more advanced. The videos we watch are more advanced. And he loves space. And so we got him an Easter book, space book. But I just found out that the International Space Station, some of the astronauts have just landed last week. I want to say Thursday. So I'm going to queue that up for him today. He loves SpaceX. So I'm like, maybe you can be an engineer. So, but he'll do whatever he wants. We'll support him in any profession he takes. If he wants to be artistic or an animal doctor or whatever. But is there a video on collagen? I actually have done a video on collagen. The vendor that I recommend in that video does not produce collagen anymore, but I have an alternative. And I love it. It is, what is the name of it? The name of it is Further Foods. So Further Foods, I don't think it's furtherfoods.com or Further Food, but check them out. NHR15 is my coupon code. So NHR15 gets you 15% off. I love them. They have the chocolate reishi. That's what we consume. And Gabriel eats that every day. I take a basic vanilla bean extract, flavored. Sometimes it's coconut yogurt. Sometimes it's an almond yogurt. And then we add that in, and he's like, I'm eating chocolate. And he's eating reishi mushrooms. And he's like, eats it up. And usually we'll have that at least once or twice a day. And I throw in magnesium. I do green powders. He can't even see the green powders because it's brown. So I just check that out. Okay. So yeah, SpaceX. Yeah, you live by SpaceX. Yeah. So I've promised him, we've totally told him that at some point we will take him down to Cape Canaveral. So we will have to, you're an engineer. Oh my gosh, no way. That's awesome. Yeah. So he is totally into, we've watched the Falcon 9. I think it's the Falcon 9. He actually can point it out. Like the book that we got had like a series of different ships or what are they called? Rockets. So he can point those out. But the new one that is being worked on, are you working on that, Whitney? I know that is really cool. So, but yeah, he's totally into that. And I think Elon Musk is brilliant. So, and his mom is gorgeous. His mom's a model for, I think, is it CoverGirl? And she's like 80 and she looks amazing. And she is revolutionizing what we think of aging and beauty. Okay, so enzyme therapy, I actually could totally do more on that, but I think I actually did one a little bit, But enzyme therapy is actually using proteolytic enzymes and other like metabolic enzymes. So there aren't just digestive enzymes, and those can be very powerful because enzymes are the switches in the body. So enzymes turn things on and off. Sometimes in their deficiencies or an imbalance, it can cause things. Yes, the essential oil, it was called Abundance. And I actually need to call the brand. I think I might start selling that online. I actually feel when I mentioned it, I was like, oh, I really missed that. Oh, so good. Everything would smell like it. It's just a fantastic scent. Okay, you guys, I'm going to run because it is midday breakfast time. I know Gabriel's going to want his little midday snack, mid-morning snack. But definitely tune in tomorrow. Tomorrow we are going to talk about, let's see, I had the topic and I thought I wrote it down. Tomorrow we're definitely going to talk about another powerful topic. So tune in. I'm also going to probably do a poll later on YouTube. And by the way, if you are new, please hit the subscribe button. Give me a thumbs up. This takes a lot longer to wrap because YouTube's managing their bandwidth. Tons of people are going live every morning. Saturday might be a little bit better, but I know pretty much everybody I know goes live at 8 or 9 in the morning. And Joanne got her Etsy shirt and don't stand, so don't. Oh, that's cute. I love it. Yeah, there are some really cute ones, and they have some good quarantine birthday ones. So I'll be sharing those in a little bit. All right, friends, thanks for tuning in. Please hit the like, share, screenshot Instagram, and let's come together again tomorrow morning. I'll have my robe on. I'll probably have some tea instead of coffee. Dragon. Oh my God, that's so cool. I can't wait to, Whitney, will you DM me? Because Gabriel is going to be so excited. All right, you guys. Thanks everybody for tuning in, and I will see you tomorrow. Bye, everybody. All right, YouTube. Thanks again for tuning in, everybody. For our private community members, I'm going to try and go live with you all for a private Q&A session tomorrow at 3:30. I'll post that information also on YouTube as well. And I am working diligently on getting that webinar, the hormone webinar up. So I might just do one every month, and that would be kind of the main one. So, all right. Thanks everybody for tuning in. I hope you guys have a good day. Bye.